Hello, and welcome to this module on mobility and aging in adults with intellectual and developmental disabilities. This module is part of our series on general aging in intellectual and developmental disabilities. It was prepared by Mary Beth Cadlick, Program Director of the University of Massachusetts Center for Autism and Neurodevelopmental Disorders. She is an assistant professor at University of Massachusetts Medical School and an occupational therapist. Mobility is key to good health and quality of life. Decreased mobility may reduce daily functioning, and conversely, maintaining mobility helps maintain independence. We think of mobility as moving around, and while that's part of the definition, mobility can be achieved in varying ways. So what is mobility? An occupational or physical therapist would define it as having the ability to get where you want to go and access the activities that are meaningful to you. This includes moving your body or any specific equipment as effectively and efficiently as possible to participate in life as fully as possible. It's important to note that mobility involves more than moving your arms and legs to get around, perform tasks, or participate in activities. It's broader and encompasses eating, which requires coordination of muscles in the mouth and throat to chew and swallow food without choking. As people age, there are changes that may impact our mobility. For example, muscle tone and muscle strength decrease, especially as participation in activities decreases. Initially, this often affects balance. The most common impact of decreased balance is seen during self-care activities, including safely managing balance while bathing and dressing, specifically when shifting weight from one leg to the other while getting in and out of the tub, to wash feet, or to take pants off or put them on. Another example is changes to our sensory system. As we age, the threshold for processing sensations decreases. We often become more sensitive to sounds in busy environments. As a result, it can become more difficult to process busy environments and social interactions at the same time. We can become overwhelmed and stressed without really knowing why. Changes in perception, memory, and reasoning may also impact mobility. These same changes affect people with intellectual disability, although in some cases changes may occur at an earlier age and may be due to comorbidities of some syndromes associated with IDD. How do you recognize when you or someone you care for may be losing some function with mobility? Often the first signs of losing function with mobility is the loss of balance during routine activities, for example, tripping over rugs or door jambs, difficulty managing stairs, dropping items during cooking or bathing, a decrease in the ability to open or close jars or things that require hand strength, a decrease in getting around when the lights are dim, and a decrease in completing usual tasks such as meal preparation. There may be confusion about which ingredients to use, which order to combine ingredients, or where to put items back in the cabinet. Also be on the lookout for dysphagia or swallowing disorder. Some signs of that include a change in cough pattern, choking, weight loss, and refusal of some foods, wet vocal sounds, and vomiting. An occupational or physical therapist would assess functioning by asking the individual or caregivers about changes in getting around and completing daily activities. It's also important to discuss changes in mental and emotional well-being. As a result of physical changes, people often become frustrated and feel sad and may not know why. After all, it's difficult to lose the ability to do what we've been able to do and still enjoy activities that we're used to doing. If we enjoyed walks, but then balance and endurance decreased, we'll have an emotional response to this change, as well as losing the physical and mental health benefits of movement. A specific assessment will evaluate muscle tone, muscle strength, motor control, and motor coordination of the arms, legs, and whole body. Vision, hearing, and ability to perceive things through touch, changes in taste, and smell would also be evaluated. Speech therapists may conduct specific assessments of potential swallowing disorders. They, along with occupational therapists and physical therapists, want to understand any changes in cognition and communication too. The goal is to evaluate the components of function within the context of the whole person's life. In other words, how does any one factor or combined factors impact a person's ability to function? Falls deserve a special mention due to the serious injury and sometimes fatal consequences that result. This is especially true of someone who is older, especially as muscle and bones become weaker and vision decreases. Pain, loss of functioning, and fear of recurrent falls can also impact the quality of the person's life following a serious fall. Causes of falls may result from physical changes that a person experienced, such as muscle weakness, motor coordination, pain, and limitation of movement. They could result from sensory and perceptual changes, such as in vision and hearing or balance, and from cognitive changes, such as confusion or memory loss. And they may result from environmental factors such as poor lighting, poorly fitted shoes, cluttered or slippery floors, lack of rails or other supports, low chairs or chairs without arms to lift oneself out of, or a number of stairs. Maybe a disorganization of clothing in closets or drawers, loud sounds, TV, music, multiple conversations, which may be distracting when trying to complete a task. Let's take just a moment to summarize some of the factors that can impact mobility. Physical changes common to an aging adult, such as cardiovascular changes, decreased flexibility, or gait changes. Sensory changes, such as vision, hearing, and vestibular changes, sensory overload. Cognitive changes such as confusion or forgetting how to complete tasks that were once routine, or the inability to make decisions. Some medications can decrease risks of falls, dysphagia, and other mobility-related issues. Pain and obesity can impact mobility, and poor oral health may impact chewing and swallowing. So what can we do to prevent loss of mobility functioning? One of the best ways is through exercise and movement. Walking is one of the easiest and no-cost solutions to maintaining balance, strength, especially in the legs, while also being beneficial to mental and emotional well-being. Opportunities for walking include doing laps around your house or up and down stairs, walking around your neighborhood, or walking or dancing to music for a specific time each day. The more the activity is part of a routine schedule, the more likely we are to do it. Upper body activities include chair sit-ups or pushing down onto the seat to attempt to lift your body. A firm chair is best for this rather than a soft chair or sofa. Resistive or strengthening activities using small weights or even cans of food to lift in a sequence of movements, or using therapy putty, TheraBands, or cooking activities where putty or dough is rolled or pressed down or made into shapes. These are all good activities. Balance and strengthening activities may be modified for people who need to remain seated. Yoga is a great activity for maintaining or increasing whole body strength, balance, and a mental and emotional well-being. There are videos of using yoga with elders or those with limited mobility that could be beneficial. Make sure you schedule exercise for when the person is most alert or when he or she needs a movement break to increase alertness or to relieve stress. In conjunction with what we do with our body, it's also important to review what we put into our body. The type of food as well as the amount and when we eat all affect blood sugar, level of attention, and overall physical well-being. It's important to evaluate the diet to determine if any aspects of food intake is affecting one's health. It's helpful to know if the person is hungry or tired or reacting to a temperature in the environment. In addition to maintaining a balanced and nutritious diet, food may need to be adapted for people with dysphagia. Food may need to be ground, liquids thickened, and some foods may need to be avoided, such as sticky peanut butter, stringy food like celery, or small particle foods such as nuts or popcorn. See the Department of Developmental Services webinar on dysphagia, aspiration, and choking on the Center for Developmental Disabilities Evaluation and Research website. Also evaluate medication regimens for any side effects and interactions that could impact mobility. It's important to pay attention to the physical environment at home or at work. Use good lighting. Install physical aids such as rails, or use assistive devices such as walkers or canes. Remove clutter or obstacles, especially area rugs, cords, wipe up spills, and be careful as to where you place furniture. Make modifications in bathrooms such as shower seats or tub rails. Provide clear visual aids to help people navigate their environment or complete tasks. And make sure that shoes and clothing fit well and don't have loose laces or cloth that could trip the person. Think about helping someone at a dance, where one person is leading the other while the other follows. Then that role changes, quickly, in a fluid or not so fluid way as someone ages. The strategies that were once effective or okay for someone may change, and the person may get frustrated or may not respond, causing confusion. This is an opportunity to stop and step back to observe and notice what might be going on. Given that multiple changes are taking place in the brain and body, the best bet is to slow things down and observe the person's response to an adjustment in pacing of directions or completing tasks. Giving sufficient time is one of the most effective strategies for helping the person to process information, whether it's verbal, touch, or movement. Also, it's helpful to break down tasks into small chunks. Providing visual supports cannot be underestimated, even if you don't think the person needs them. Provide simple and visual schedules for the day and instructions for activities that the person is struggling with. This can go a long way with helping the person feel successful, feel good about themselves, and minimize stressful interactions. Also, offer options. For example, offer 2 activity choices that are equally beneficial and preferred. This helps the person maintain a sense of self and control and may minimize conflicts. Keeping active is vital for good mental and physical health overall, but clearly helps maintain mobility function. It's never too late to start, but ideally, becoming and remaining active throughout the lifespan is the goal. Finally, work to support overall physical, cognitive, and emotional well-being, which in turn helps promote and support active engagement in people's lives. Thank you for listening to this webinar. This has been a module which is one of the series of webinars on general aging with intellectual and developmental disabilities. Additional webinars appear on your screen. For additional resources on general aging with intellectual and developmental disabilities, and to access the webinars that were previously recorded, please visit either the Massachusetts Department of Developmental Services or the Center for Developmental Disabilities Evaluation and Research websites on aging with intellectual and developmental disabilities. And once again, thank you for listening.